Welcome back, everybody. A doctor on the Gold Coast has sparked controversy after urging women in their 20s to start undergoing fertility tests. He suggests they take the quote-unquote egg timer test, which is used to tell women how many eggs they have left and how long they've got before they should start a family.
So at what age should women start being concerned about their fertility? Well, fertility specialist and expert Dr Lynn Burmeister joins us now from Melbourne. Lynn, good morning to you.
Good morning.
Fertility tests are common, aren't they, for people wanting to fall pregnant? But tell us more about what the egg timer test actually measures.
So the egg timer test measures the amount of eggs that you have left. So it gives you an actual gauge of how many eggs you have left. So it's not exactly the number of eggs, but it's more like a gauge. A bit like petrol in your car, it will give you a gauge whether you're low, medium or high. And it involves a series of blood tests that assess your hormones, and one test also that is called the anti-Müllerian hormone that is produced by your small eggs that you have left, and also an ultrasound. So you need to combine the three tests to get an accurate assessment of where your egg bank is, basically.
Now then, we all know that fertility does decrease with age, but this doctor on the Gold Coast is urging women to take the egg timer test before they hit 30. Why would he suggest this?
Well, I suppose we're born with 1 to 2 million eggs. By the time we're teenagers, we've got 400,000 left. And by the time we're 30, we have about 10% of our eggs left. So that's still plenty of eggs to get pregnant with. But I suppose what he's trying to say is that your egg bank can be low in your 20s, and it is a good idea. He's saying that it is a good idea to check your egg bank in your 20s, but this needs to be taken with caution because sometimes your egg bank will come back low if you're on the pill. So there are certain things that will affect your egg bank, and so the test needs to be correctly assessed by a fertility specialist once the test result comes back.
So what you're saying is with this test there is margin for error. My question then would be, is this test potentially creating unnecessary concern and alarm for young women?
Yes, it is. So when the girls get their tests done, and if they are on the pill, it will come back low, including an ultrasound will show that there's hardly any eggs in the ovaries whilst you're on the pill. So I've had plenty of patients that come in alarmed about this result, and the only way that you can get an accurate assessment of their egg bank is to take them off the pill. And if we take them off the pill, they may then have an unwanted pregnancy. So this test does need to be taken with caution. I wouldn't advise patients to do their egg bank test unless they have a family history of early menopause or unless they had some gynecological conditions such as endometriosis or a history of ovarian cysts. I don't think the test is necessary to be taken in your 20s.
It occurs to me that it's potentially a push for these young women to freeze their eggs. Is there any merit in me drawing that conclusion?
It does sort of lead to that, and we've got to remember that most people who freeze their eggs will never use them. So we're going to have IVF units that are filled with vats and vats of eggs that will probably never be used. And that's been shown in studies now. There was a big study in England where they followed up all the women that had frozen their eggs and hardly anyone came back to use them. And we also need to remember that egg freezing can have complications. So it is a surgical procedure to have your eggs frozen, and there can be risk of infection and bleeding from an egg collection. So it's not a completely benign procedure.
Lynn, let's then play this out then. So what if somebody's concerned about this, they want to do something about it, they go along, they come off the pill, they do this egg timer situation and they find that they do have a lower egg count. What do they do then?
So they come and see a fertility specialist. I would tend to repeat the tests and also repeat the ultrasound. And if I thought that the patient did have a lower egg bank, then I would probably encourage them to freeze their eggs. But again, it would need to be the tests need to be correctly assessed and probably repeated in the first instance.
All right. Lynn Burmeister, as always, giving us your expert insight, and we appreciate it very much. Thank you.
Thank you.
And if you have any questions about fertility, you can head to Dr Lynn Burmeister's website for more.
She's
we'll make
the
sure,
best.
isn't she?
Yeah, she's fantastic.
Yeah.